Healthcare in South Australia is tonight on the cusp of a major shake-up, with pharmacies now able to administer more vaccinations, taking pressure off our doctors. State political reporter Ollie Hay joins us now. Ollie, talk us through these changes.
Well, Brenton, as part of major reform introduced today, 10 more vaccines have been added to the pharmacy program. They include for chickenpox, measles, meningococcal, tetanus, polio and shingles. Now, the Health Minister says it means SA will have the most extensive scheme in the country, with many pharmacists already trained up thanks to the COVID pandemic. And while convenience is front of mind, it could also be cheaper for patients than getting vaccinated at your doctor.
My instinct in it is that it would certainly be a little bit cheaper, given the gaps that inevitably a general practice has got to charge these days to be able to keep going.
Now, it's expected most pharmacies will take part helping take pressure off our stretched GPs, and that will also mean patients heading to our struggling hospitals as well.
Anywhere where I can see an opportunity where we can safely relieve some pressure on our GPs and have people being able to get the health services that they need in a safe way elsewhere, then I'm very keen to take up.
But fixing our health system will take more than just support from our pharmacists. And today, Prime Ministers and Premiers endorsed a multi-billion-dollar rescue package.
The Prime Minister primed for problem solving.
Good morning, Prime Minister. Ready to play nice with the Premiers?
I'm really looking forward to a constructive meeting.
Front of mind for the Premiers.
I think the number one issue across Australia is absolutely health.
The big issues are clearly health. Substantial challenges facing the country, particularly around the health system and the GP crisis.
Shortfalls in primary care leading to ramping at emergency departments across the country.
Today we're talking about a better future for the Federation.
And for the first time with the new New South Wales Premier.
Does it feel like your first day at school today, Premier?
It does a little bit to be the new kid on the block.
For 2 hours, the leaders discussed how to fix the nation's ailing health system before emerging to declare.
So there's not a single solution. There are a range of reforms.
A $2.2 billion suite of measures to boost primary care by allowing nurses and paramedics to do more, pharmacists to give any vaccine on the National Immunisation Program, and incentivising GPs to stay open longer.
People on the ground who run the hospital system know the pressure that it's under, and the Commonwealth is up for ideas on how we improve primary health care.
Try as they might, one of the biggest issues within the health system is a shortage of GPs. There was no firm solution on that today, no easy fix ahead. The Australian Medical Association's Public Hospital Health Report Card showing just how sick the system really is, finding only 58% of urgent patients were seen to within the recommended 30 minutes and 1 in 3 staying in the ED longer than 4 hours with no hospital beds available.
And what we're seeing in this report is the worst we've ever seen.
Reece D'Alessandro, 9 News.